If you haven't heard before, June is Men's Mental Health Month. It really shines a light or brings awareness to the issue of men's mental health. And when you think about it, not enough had been done prior to, let's say, now, and onward efforts about men's mental health, prioritizing that issue, resourcing support as it relates to that, and really just changing how we view men's mental health. Now, to help me unpack that, we have joining us via Zoom Sule Joseph. He's a psychologist and he's also the host of WESN's show Psyched. Sule, good morning and welcome to the program.
Good morning. Thanks for having me.
Now, we are talking about the issue of men's mental health, and we're both men, and this is something that even on a personal level, I'm sure that we may have things that we can relate to. And the fact is that many other men do have some of the same issues and so forth and can relate, but the problem is that the conversation isn't happening as it ought to. I listed out because of the stigma that is involved in there. Are you seeing it from only that perspective, or are there other reasons that we as men find it very difficult to have those conversations?
Ooh, all right. So that's a lot to unpack.
Yes.
That's a lot to unpack there. First, I kind of want to establish that everybody would have at some point have some mental health struggles if we understand what mental health is. Mm-hmm. And if you look at physical health, and you can say sometimes you're not physically healthy, then you can imagine that sometimes you'll have any and everybody could not be mentally unhealthy sometimes or at some point. All right, it's a scale, as I usually like to say. Now, having said that, you have a number of factors, right? A number of factors that contribute to men perhaps not necessarily being diagnosed correctly with mental health issues, or at least not feeling comfortable to even go to be diagnosed in the first place. Mm-hmm. And a lot of that comes out of some of the socialization of men, the culture, the practice of most men not wanting to go to the doctor, socialization where we were taught, even as children, to shake things off. Mm-hmm. So whereas girl children may have been fostered, cared for, if they were going through an incident, perhaps if they were crying or they felt emotionally that they were struggling. Particularly, let's say the Caribbean, for example. I want to use Trinidad as a perfect example. Mm-hmm. Oftentimes for men, what you would find instead is a culture of trying to toughen them up. To get men to practice being able to shrug off emotional issues. And so when you get older, that's the practice. The practice is not to accept whatever emotional issue or turmoil you might be going through, but instead to try to shrug it off. Yeah. And of course, we know those, just shrugging those things off can, of course, often lead to issues of mental health.
And we know that when we think about mental health, whether with males or females, the issue of suicide arises. And according to reports in the United States, for instance, men are 4 times more likely to commit suicide than women. But you would have women who would be more than likely to access the kind of care necessary for them to not just cope, but to solve many of the problems that they grapple with. Bringing that down to Trinidad and Tobago and practicing as long as you have, or at least seeing clients that you do, and just as a normal citizen, have you noticed any changes in terms of that information, men less than likely going to seek out help or having those difficult conversations? Are you seeing any changes at all?
Statistically, to give you a definitive response statistically is difficult. We don't really have quick and easy access to local statistics on unfortunately on those type of issues. Sure. However, what I can say is that I have, if I use the eye test or at least the experience, yes, that I've noticed gradual shifting away from, or the destigmatization of men being able to seek mental health actually is now being encouraged. Mm-hmm. And for the men who don't feel comfortable because of, again, socialization and perhaps how they were raised, mm-hmm, who don't feel comfortable being a bit demonized or characterized as this term that I don't agree with, being toxic masculine. Yeah. So we find that so yes, there's been a gradual shift towards men accessing assistance, mental health assistance, but you still have a culture to combat where a lot of men were socialized in thinking a real man can handle their own problems.
Yes.
Right? And it somehow makes you less of a man to see a therapist and request help. I would imagine that the statistics would be showing an improvement, I suppose, in men seeking assistance.
And I'm glad that at least from an observational standpoint, you can agree that there are changes, because I can even relate to where I feel as though now more than before, my male friends, we are able to have those kinds of conversations in a very comfortable way about things that are affecting them, issues of depression and anxiety and so forth. Those are things that even when we look at top leadership around the world, you are seeing leaders who may not be as aggressive, male leaders who may not be as aggressive in their approach. And many a times that has a trickle-down effect where people feel it more okay to be in tune with their feelings, men especially. So if you see some kind of a tragic incident and you see a male leader, a strong male leader coming out and shedding a tear, that has a particular impact or effect. But what I want to jump to is even bringing that to a local context. We are hearing on the radio programs, discussions are taking place more widely, more broadly on issues that probably would not have had that kind of a public airing in the way that it is happening right now. Are you confident that we are heading in the right direction? And more so, do we have the resources necessary, let's say the clinical psychologists and so forth, available to help us along that journey?
To answer quickly, yes, I do think that we're heading in the right direction. If we're moving at a snail's pace, perhaps we are compared to the rest of the world, but we are moving in a positive direction. And by a basic eye test, I suppose, again, without statistics, you can kind of see where the culture has evolved to male children, at least, being able to express themselves and say what they like and don't like and what bothers them emotionally, and a little bit being encouraged more to share those feelings. So that is trending upward quite well. So so I would say yes to that. Yeah. As to if we have the requisite resources, I can't necessarily answer that question. I will say that I know that our educational facilities are churning out a lot of persons in the behavioral sciences field and social services field, so a lot of social workers, a lot of psychologists, behavioral specialists, and so on. As to what else the resources, whether we have all of them, I really can't speak specifically to that end. But what I will say is that we still need to see better trending for accessibility for counseling and so on for everybody.
Yeah. No,
the accessibility of it, I think, is
understood. And in terms of trending, using that word, we would have seen on social media, or at least I bear witness to, where there are discussions taking place, whether on Twitter or other spaces, when we look at the kind of content being produced or made available, there is that rhetoric of the feminization of men. When men are allowed the certain freedoms to express themselves in particular ways, you see those of a particular school of thought coming forward and using that term, the feminization of men. How impactful is that rhetoric on this whole effort to secure men's mental health and to really treat with that issue of cultural or heritage practices that men have more or less fallen victim to?
Yeah. Nikoli, I come up with some hard-hitting questions today. I won't knock it. I won't knock it. And for the sake of this conversation, let's call them purists or traditionalists, right? And persons who feel as though the traditionalism of masculinity is under attack and needs to be defended. Persons like Andrew Tate, I'd put it perhaps in a category like that. And there may be aspects of his rhetoric that don't resonate well with some people, but there are also aspects of his rhetoric or his beliefs that resonate quite well with a lot of men actually, and women surprisingly as well. And I put that in the category of traditionalists, of persons who want to stick to what they believe is the traditional values of what a man is supposed to be and what a man is supposed to bring to the table and so on. I won't say, perhaps in some aspects it can hurt, but in some aspects it can also assist. So it's hard to judge that. But I will say that to answer that your question, that it is impactful. Of course it is impactful. It's impactful because it I suppose helps regulate, for lack of a better word, it will help regulate how we move forward in seeing masculinity and the roles of men and so on as we move forward.
Understood.
Because whether we like it or not, I don't see where at any point men and women blurring the line of, well, totally blurring that line of everybody being on board and accepting that it does not make a difference. A man and a woman would not make a difference. So, for example, I'm not sure if you'll ever get to the point where Olympics will have a race where men 100 meters where it doesn't matter. There's no female races or male races. There's just human races.
Yes.
I don't know if you get to that point, right? And so traditionalists will continue to argue along that line, and purists, if you want to call them that. And so, yes, I think they will continue to majorly impact men and how we see men, and of course, by extension, men's mental health.
Understood. And ironically enough, that's something that I think about quite often. Seeing mixed football teams, mixed basketball teams, it's very interesting. And I do think at one point or another we will experiment with that, but it does seem very far off at this point. We have just about 1 minute, and what I wanted to find out, because we have Father's Day coming up this weekend, and there usually is a lot more emphasis being placed on Mother's Day as opposed to Father's Day. And people see that as, a competition of sorts, and wonder why men are not getting necessarily more attention and so forth. Discussions such as that, do you think that they are healthy within this quest to really treat with men's issues? Because we can even look at it through the lens of the persons who would say that they are feminists, and that whole conversation about feminism really is about just putting a light on women and talking men. But we know that that is not the case. As it relates to Mother's Day, Father's Day, comparing and stuff, is that a healthy conversation that's taking place?
Well, I can only speak for me in this instance, and I believe it is. Any discussion or discourse where we are trying to answer questions, because the fact that we're having the conversation is because some persons are asking questions, and so it resonates, or it's bothering us across section. And any conversation that we can have that is open and respectful, that helps ease the stresses or concerns of our population, to me, could only be a good thing. Because we have when we talk about parental alienation, and I know you didn't ask me that, but that's one of the major issues that men tend to suffer with. Parental alienation, which is when they have separated or parents no longer on good speaking terms, perhaps the mother utilizing the children or keeping children away from the father to punish them, right? Or to alienate the father for whatever reason, alienate the father from the children. And usually those type of issues cause men issues with depression and mental health and so on, right? Besides work, that's one of the other major things that affect men. And we don't necessarily have those conversations. So for the things that we do have the conversations about, I'm hoping that spills over into other major male issues. Yeah, we don't. This is Men's Mental Health Month. When we have Women's Mental Health Month, it's a big thing. When we talk about breast cancer and so on, that's a big thing. Prostate cancer is not so much a big conversation, because I still think we try to maybe overcompensate for the lack of consideration for women, perhaps over the years. And in so doing, we need to ask the question: are we undercompensating, or perhaps even now ignoring men and allowing men to treat with these issues themselves?
Right.
So we're asking men to progress mentally and to continue progressing, but as a society, are we supporting them in that?
Definitely important conversations, but unfortunately time has run out. And I do hope that people continue these kinds of conversations in the different spaces and places, because that's the only way that we're going to move to a much better place where we see equality, where we see equity, and we see people getting the kind of care and attention necessary. Sule, let me thank you so much for joining me this morning to help unpack Men's Mental Health Month, which is June, and we even spoke a bit about Father's Day, but thank you for joining me.
No problem. Thanks for having me.